Hi, this is Dr. Niraj Vora and you are watching me on sifi.com.
Please brief us on the pros and cons that surround a hip replacement surgery.
Hip replacement is, in India we do it in two situations. One is when you have arthritis of the hip, which is typically seen in the younger age group. Now, knee arthritis typically presents to us 55 years plus of age. The ages are slowly coming down, but these days it's approximately 55 upwards. The hip arthritis, on the other hand, is usually seen in male patients more frequently, and they are usually in their 40s. So it is a much younger subset of patients who are potentially more active and have got a lot more social responsibility that has to be fulfilled and cannot be held back because of the restrictions that a painful hip puts on them. A hip replacement will once again take away their pain and restore their mobility. And also, in many cases of hip arthritis, there is a significant limp associated with it because one leg becomes longer or shorter than the other. The hip replacement also does try to attempt to address this situation, and in most instances the patients also find that their leg lengths have been equalized. Overall, this procedure is very successful, and long-term outcomes show that patients are happy for a minimum period of 15 to 20 years, following which they may or may not require a redo. But I always tell patients, live for today. But who knows what's going to happen 10 or 15 years down the line? Not to worry about that situation. Enjoy the life for the moment. This is the time when they have got productive years. Be productive in those years. As far as risks are concerned and the cons of the situation, everything has two sides to it. So there is a small element of risk associated with this procedure, but overall risk is extremely low. Standard risks associated with any operation in the form of an infection or blood clot, etc., are there, but all joint replacement surgeons take extreme care and caution to try to minimize these risks. Therefore, I would strongly advise patients who have got a hip problem which is bothering them to not worry, seek out the best surgeon in your area and go and meet that doctor. You will not regret it.
How does trauma surgery help to alleviate pains, restore movement, and prevent the fractures from worsening?
When you have a broken bone, it is an extremely painful condition. It comes to you with no warning, like arthritis will usually you know you're headed towards an operation. With the fracture, it's like 1 minute you're walking and the next minute you're on the ground with a broken bone. And this is extremely painful, and the treatment of this has been, once again, because of the stigma associated with surgery and the fears of the unknown, etc., a lot of patients say, well, doctor, can't we do this without an operation? The problems of trying to treat trauma without surgery is that you are not able to align the bones accurately, and as a consequence, you may compromise the final outcome. As a result, there's a lot of fractures which require surgery, and we actively try to counsel the patients into understanding that the operation is the right thing for them and that they must not look at it as an unnecessary exercise, and they must not think that there are ulterior motives in these surgeries being advised. If you were to, let us just give you an example, if you were to break your hip bone, which is a very, very common fracture in our elderly population, if this surgery was not done to fix the hip bone or to replace the hip bone, then your patient would be lying in bed for a minimum period of 3 to 4 months in pain. The fracture may not unite. Even if the fracture does unite, it will unite in a position which is not optimum. Besides that, there are risks associated with lying in one place for too long, bed sores, chest infections, urine infections, and these can potentially cause problems with the long-term health of the patient. If, on the other hand, they had to have surgery, they would be up and about the next day, and within a week or two, they would be walking around the house on their own without any help or support from any family members, thus also restoring their own independence, and they should not feel that they are dependent upon family members or are a burden on them. So as a result, surgery for trauma is becoming increasingly advantageous, and as a result, it is becoming increasingly popular.
How do you see the following factors affecting one's bone structure, making them fragile in the long run? Age.
With age, we find that osteoporosis can start to set in, thus making the bones a bit weaker. With age, we find that there are problems with coordination and steadiness while walking, and all of these factors could result in patients slipping, tripping, or falling, and as a consequence could break a bone. So one has to be a bit more careful. Maybe use a walking stick if you feel not confident enough without one. Do not feel embarrassed, because it is a lot more embarrassing to be found on the floor than it is to be seen with a walking stick.